Professor Padmaja Kumari ji, welcome in RIMS. Professor Sunil Kumar, our MS, beloved MS, Professor Hiren Birua, Dr. Bharti Kashyap, Dr. Rahul, senior faculty members, founders of ophthalmology in Jharkhand, faculty members, residents, and people from press and media FNA. Ophthalmology subject which has been a very favorite subject of mine. Even today, I can teach neuro-ophthalmology better than an ophthalmologist, and this can be verified by more than 2 dozens of publications of mine pertaining to neuro-ophthalmology. In ophthalmology also, just to tell you, you can take it in a very lighter way. I was interviewing the faculty of 6 AIMS, and incidentally the ophthalmology part was falling under my domain. One of the Britishers ophthalmologist who was very smart, dynamic, was bubbling with the knowledge of ophthalmology, and he was pretty sure that he would be selected in one of these 6 new AIMS. When I started him interviewing on neuro-ophthalmology, he went out and he said to the people that I could respond to everybody barring one neuro-ophthalmologist who is sitting there. So somebody told him, who is neuro-ophthalmologist? The person who was in the shirt and putting the specs. The person told him that he is not neuro-ophthalmologist, he is neurosurgeon. So he opened the net to find out the answers of few questions. It was just in sequential manner. You know, in interview, when you are interviewing the candidate, you are always smarter while sitting on this side. You are very poor one while sitting on that side. Even if I am interviewed on that side, probably I would also develop scanning of speech. So no wonders. But just for the sake of informing that I am a known person practicing neuro-ophthalmology, even in neurosciences, I am invited most of the times to teach the neuro-ophthalmology part of the brain, which is of course quite difficult, very difficult I can say. When in this country only 4 or 5 people were operating the orbital tumors, I have series published in world literature where I have contributed in that part. Anyway, the subject is different here. But let me tell you that Regional Ophthalmology Center, which is coming in RIMS as a new center, was coming so slowly that from 2014 it is coming and it could never come up. Sometimes it seems insulting also. But in last meeting of mine with Honorable CM, I took this agenda. And Honorable CM was surprised to know that since 2014 this building could not be completed. There had been problems at our end also. But then I requested Honorable CM to give a dead date to them. So February 28th was the last date. But I believe within a month we will have a regional ophthalmic center in RIMS. With that, probably the RIMS would be better known for ophthalmological services. And the steps taken by head of department and rest of his team, Sunil et al., in order to promote the different kinds of the surgeries, because ophthalmics itself has mushroomed and proliferated in different manners during last few years. As far as the diabetes is concerned, we know The diabetes is one disease. When I was a student, I tend to see a student of MBBS in 80, from 80 to 85. The diabetes was found to be diagnosed in rich patients. The patients who tend to be a bit obese, overweight, and wealthy in containments, those were the people, that was the particular strata, segment of society which was prone or predisposed for the diabetes. Today, the diabetes is known to occur to the tune of, though in literature it is 12 point some percent, but I know that it is more than 15% in India. And as we know that diabetes is one of the disease which involve anything from hair to toe. In head, it has skin problems, it has diabetic neuropathy, it may be diabetic cranial neuropathies, there may be, because of depletion of immunity, there may be several kinds of infections and infestations in the brain. In neck, the thyroid might be having some problem. In axilla, there may be pigmentation problems. In heart, there may be ischemic heart diseases. In gastrointestinal tract, one might have developed ulcerations. In pancreas, you know, itself is the responsible for such a thing. In kidneys, you have diabetic kidney diseases. In blood vessels, you have hypertension. In legs, you have ulcerations. You may have peripheral neuropathy, you may have diabetic neuropathy, you may have autonomic neuropathy. What I wish to say that diabetes is one of the lifestyle disease like hypertension and spondylitis, which do not spare any system of body. And it has reached to the level to involve even the minor vessels. You might be knowing it better, but as per my knowledge of MBBS and during the neurosurgery training, the retina may have different kinds of the changes, starting from microaneurysm to the dots, to the small hemorrhages, to the venous changes, to the edema, to the soft exudates, hard exudates, neovascularization, subhyaloid hemorrhage, vitreous hemorrhage, what not. All the complications, complications are so rampant in eye. So obviously, the eye surgeons or eye physicians need to be very vigilant as far as the diabetes is concerned. I did not know about the vitreous injection because I read these VEGF inhibitors and non-VEGF inhibitors and metameric inhibitors and gene, different kinds of the killer suppressor and inhibitory genes which have role in oncology. But Sunil told me yesterday while visited for inviting me that even the VEGF inhibitors, maybe ligand inhibitors or receptor inhibitors, they have a particular and pertinent role in diabetic retinopathy. It was information for me. You are expert here. I think you must be availing this kind of opportunity to develop skill. This was the medical part. Let us come to the spiritual part of vision. There is something more than vision. And what is that? Vision in the eyes of Buddha is something different. It's not the similar vision of 6 feet. No, not at all. Out of 6 precepts which are believed by Buddha, one of them is right vision. What are the 6? Right speech. That means truthful speech. Right actions. One of the right action may be the learning the skills from the experts. Right actions. Right livelihood. Eating out of your earning without harming the other person. Right livelihood. right efforts to know the correct thing, to harbor the correct knowledge, to get devoid of darkness, to come into the world of the knowledge, to improve the ignorance, right efforts, right mindfulness. This word is rampantly used today. What is mindfulness? Mindfulness is very difficult. Today, in almost every seminar of management, this term right mindfulness is used. Let us define this term today. The mindfulness means a focused, neutral, unbiased mind focused to a problem which is present before you, devoid of your emotional amalgamation. That means mind should be full as to whatever you are doing at present moment. You should be fully aware as to what you are doing, and how should it be done, the way it should be done, the way it should be performed in future, and it should be fully concentrated mind towards a particular problem. Then Buddha said about the right consciousness, right meditation, which is most difficult. And then Buddha said about the right vision. Here the definition of vision is not 6 by 9. It is something beyond that. And what is that? Please record it. It can be put on, because if I am asked to repeat the same speech, I cannot repeat. Right vision means, this term I can define. How many minutes do I have?
So you can speak.
Oh, very great. Even as per my habit, once this come to my mind, I was fully in mindfulness with the purchase today, because I am coming from purchase committee. So I was in that mind, but moment I sat here, I got the time to, churn up few things. Now, what is right vision? If ophthalmologist is asked, he will say 6 by 9 is the right vision. Do by pinhole or correct the refractory errors. If there is a little muscle weakness, then do exercises, and wo billi dekhte raho, focus karo central. Different kinds of. If psychologist is asked about the right vision, he will have different definition. You should be devoid of illusion and hallucinations. That is the right vision. You should be not live in the virtual world, you should be living in real world. Psychologists will define it like that. If a neurosurgeon is asked about the right vision, he will say, well, see whether it is a primary optic atrophy or it is secondary optic atrophy. If it is a primary optic atrophy, take out the tumor from sella and pericellular region, paracellular region. If it is a secondary optic atrophy, try to treat intracranial hypertension. But if Buddha was asked about the right vision, then it was something different. How does it connote in the words of Buddha? The world is full of sufferings. World is full of suffering. We are living in midst of these sufferings. The world is suffering. Everybody is suffering. The world is full of sufferings. Then what should be done? The way the doctor diagnosed the suffering, the disease, there must be a cause of suffering. Without cause, there is no disease. If diabetes is there, then retinopathy is there, then neuropathy would be there. So if you treat only symptom, retinopathy, will it be cured? No. Until we treat the diabetes simultaneously vis-a-vis with the treatment of the diabetic retinopathy, the retinopathy would not be taken care of. So suffering is there, and there must be a cause for the suffering. If the cause is established, then there should be a treatment of suffering. Obviously, if there is a cause, there is a treatment. Where there is no cause, there is no treatment. When I was a student, there was a cause of list: congenital, acquired, infective, neoplastic, and then the heading was idiopathic. This idiopathic was very rampant during my training, but today this list of idiopathy has decreased to almost dismal level. Whatever we did not know, it was idiopathic. If something was idiopathic, there was no treatment. Today we call them with the different name, autoimmune disease, blah, 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 rare disease. Diseases were there, but we did not know. So there is a suffering, and there is a cause for suffering, and there is a treatment for the suffering, and ultimately there are ways by which the sufferings can be prevented. That means preventive medicine. Most of the times we feel when I was doing MBBS, I was bothered as to why there should be a preventive medicine department. Excreta disposal, सॉफ्ट वाटर, हार्ड वाटर. अरे म्यूनिसिपल कारपोरेशन वालों को पढ़ाओ, हमको पढ़ाने की क्या जरूरत है? I had been thinking like that. Hard water, soft water, air conditioning, criteria for air conditioning, overcrowding, different kinds of the preventive. So Buddha said there are ways to prevent the disease, prevent the sufferings. And Buddha said if somebody knows on this earth, to have a successful life, about the sufferings, about the cause of sufferings, about the treatments of sufferings, and about the ways how to prevent the sufferings, then that person is called as the person having a vision. So the definition of vision varied from ophthalmology to spirituality, and it varied to varied extent. So what I wish to convey, and then there are different aspects, right vision and right understanding, ultimately resulting into the wisdom. Wisdom is something. What is wisdom? Again, there would be very long lecture, so I would not deal with the wisdom. I will leave you at this point. I think for these many minutes you have tolerated me. Thank you very much.